hope you all saved some questions, because what I think you'll end up seeing is some of what Alon has already been talking about is what I will also be talking about. So my name is Lynn, and I work at a company called Talkspace. And we are an online behavioral health therapy app. It is proprietary and confidential. And so, kind of going back to the roots of the company, why did we get into this space? Well, as you saw before, there's about 1 in 4 to 1 in 5 people in any given year who experience a mental health condition, and yet such a small fraction of those folks are able to access care. And for anybody who follows the mental health industry, you would recognize last year the World Health Organization declared depression as the leading cause of workplace disability. So given all of the physical health ailments that exist, depression was the leading cause of workplace disability. So that's pretty telling in terms of the need. And as we've already discussed just previously, what are the reasons? Why, if people are experiencing these mental health issues, why are they not accessing care? And so we did look at those barriers, as we called them, the front-end barriers to care. And it was around cost. It can be pretty expensive with or without insurance. Access. So we were listening earlier to physical therapy. Who can get to a recurring appointment every 2 weeks or 4 weeks? And that's very similar to behavioral health, and even more so. If I'm only meeting with my therapist every 2 weeks, I have to kind of remember all the triggers that happened in that time, and I have to remember what my therapist is telling me in that short 50-minute session that we have together. Stigma, of course, still very alive and well in many parts of the country, and even just sitting face-to-face with a therapist. And then lastly is the match. As Alon referred to, oftentimes that link with the therapist is one of the most telling features about whether or not therapy will be successful. So Talkspace was created about 6.5 years ago, and we launched in the consumer market. So for about the first 4 years, we were in the consumer space, and we learned an awful lot about what behavioral therapy could be for people who were needing it and had challenges accessing it. So I would tell you that we started off as a live video therapy company. Makes sense, right? Who wouldn't want to do live video? And as we heard, I think it was Siggy earlier talking about, people don't want to do video with their therapist. It's just not what they want to do. Especially in today's world where everybody is glued to their phone, we learned very quickly that messaging and sending text messages to their therapist was really so appealing to them. And I would tell you, even today, we offer live video. We offer a free 10-minute live video session with a therapist. Our uptake is so low because people get into that mode of messaging, and it's very comfortable, and they're behind their screen. We've treated over 1 million people on the platform in our time, and in about the past 2 to 3 years, we launched into enterprise markets. So that means we are now working directly with employers as well as health plans, and a lot in the Greek organization, Greek life, so fraternities and sororities, and hopefully working into the university space eventually as well. One of our other statistics is that we are really proud of the fact that for 70% of our users, this is actually the first time they have been able to successfully access care. So when we think about all those front-end barriers, we say, yeah, we're actually helping solve a lot of those. So again, it is online messaging-based therapy. You can leave text, audio, or video messages for your dedicated therapist. We also have a very sophisticated matching algorithm, and that's been really one of the happy accidents about messaging therapy is all of a sudden, beyond being able to treat people, we have massive, massive amounts of data based on different conditions and what's been effective, and we're able to not only indicate for our users how their outcomes have been, but also able to look at the effectiveness of the therapist and who is most effective at treating depression in the state of Kansas. And for those that maybe aren't at that level, what are the tools and techniques we can give them as coaches? What coaching sessions can they go to? What webinars can they attend? Very similarly, we also have a very rigorous vetting process for our therapists. They go through about a 4 to 6 week boot camp process where we're helping them translate those face-to-face skills into the digital approach. So how do you convey empathy? How do you engage somebody? What do you do if someone's radio silent? And there are really consistent check marks along the way, or check the boxes, to make sure that they really will deliver the highest quality care. We credential all of our providers according to NCQA standards and above. Of course, we need to do that as part of our contracts with the larger insurance companies that we are currently working with. We have about 3,000 therapists currently on the platform, and we're lucky to have one of them here in the room with us today. So actually, I want to go back one slide and show you just a little bit of how it works. You know, I come from a previous behavioral health background, living in the EAP world, where all the customer complaints were, I can't find a therapist, and you give me a list of 10 providers, nobody calls me back, and they're not even, the ones that do tell me they're not taking EAP anymore. So we know that the wait time for appointments, 4 weeks, 3 weeks, whatever it is, it's unsettling to someone who has suddenly decided that behavioral care would be a good thing for them, and now they're waiting weeks for either a callback and or appointment. So with our Talkspace app, you download it in about a minute. You take about a 2-minute survey to build a profile of yourself that we then use to match against the profile of our therapists. We give you a selection of 3 different therapists, and you can do your own research to understand what are their interests, what is their style, what is their philosophy. They leave a short video for you. So you have some user control over who their therapist is. But at the end of the day, they're starting therapy pretty much the same day they decide that it would be beneficial for them. It is also asynchronous, it is not real time, but through our years of information, and we have a very robust team of data scientists, we've studied user engagement patterns and understanding what are the expectations of users in terms of therapist response times, what are they comfortable with? And we've learned a lot from that in terms of setting expectations is really critical. So as a user, if I know my therapist is going to be on the platform from 8 to 10 in the morning and 8 to 10 at night, I can send 10 messages during the day and expect that in the evening I'll probably be getting answers back. Similarly, we have a lot of testimony about how beneficial this has been for people. We also get a lot of positive feedback from our therapists who love being on the platform because it does make them more effective and efficient and deliver high quality care. And it also provides a very strong sense of community amongst them. They have a very tight digital network across the country working together. We also give them a lot of tools, as I mentioned, kind of a structured approach to treatment, but still allowing for the art of therapy to come into the mix. We obviously have done a lot of research, not only around the efficacy of this with Columbia University, but also in terms of outcomes. So we have one of the largest scale studies that is under review for publishing in JAMA, about almost 16,000 participants in terms of treating depression and anxiety. And you can see the results that up to almost 85% either had fully remitted or partial remission. So we're super excited about how that's progressing. Lastly, we're currently working with Michael Phelps, so maybe you have seen some of his advertisements helping in terms of the reduction of stigma. And if I can get this to work, that would just be miraculous. Okay.
It was October of 2014 that I lost all hope.
I was one of the world's most successful athletes. The all-American dream come true.
But I was lost. I questioned whether I wanted to be alive anymore.
I realized I couldn't handle this by myself. That's when I decided to seek help and work with a therapist. That decision saved my life.
You don't have to wait for it to get that bad.
Please talk to a licensed therapist as soon as you feel you need help. Brought to you by Talkspace. Therapy for all.
It was October.
I don't think you need to hear that again. Okay. So with that, I'm happy to take any questions. There's certainly, I could go on for hours. I've been at the company for just about 2 years, and it's really been an amazing ride to see the progress that we've made organizationally, pivoting into the enterprise space from the direct-to-consumer space, and how much we have learned along the way, and along with how much the data has enlightened us about effective treatment for different behavioral conditions.
Thank you so much. That was awesome.
Thank you.
Is there any question?
And you have a pretty robust advertising and marketing campaign that you use. So I have two questions. One is, what do you find to be the most effective platform to drive traffic to your site for referrals? And second, who is your primary target audience when you're targeting?
Yeah, so we do a lot of scientific targeting in terms of different demographics of different users. We do a lot on Facebook, which is maybe where you may have seen us. We also do a lot on podcasts, and we're always exploring different channels. Of course, those are our direct-to-consumer channels, but when we're working with employers, we also do a lot of direct promotion directly to their employees. Somewhat similar to how you see benefits promoted, but in some pretty creative ways. So we've done Instagram stories, more so than just your digital bulletin board that you see in the cafeteria. We tend to get pretty creative because employers are buying this for their entire population. They want people to use it, and so we do a lot of work to promote it.
If someone needs a prescription, how do you handle that?
Right, so just like happens in face-to-face today, if someone is with a provider and they need a prescription, they'll get referred out to a psychiatrist. The good news is that starting a little bit later this year, before the end of the year, we will be piloting with psychiatry in a very limited geographical region, and then rolling out throughout next year. And we see a lot of benefit for that for the client or patient. It's a very seamless experience. They can automatically transfer into a psychiatrist that can do the live 15-minute video session and prescribe what's necessary with their informed consent. The whole story is already there for the psychiatrist to see without them having to rehash what's going on.
Hi there. Hi. I have a question. I work with people who, and I'm a therapist, and I work with people who are on really significantly fixed incomes for whom even the affordable rate would be really challenging for them. And looking at this from a larger perspective, work with people who are often identified and whose information is being tracked specifically around hospitalization rates. I'm wondering if you have any plans to work with communities like this. There's a tremendous need. There are so many clients who we engage with who see advertisements for Talkspace who would love to participate, and it would be a wonderful use of everyone's time, and I think would really contribute to a reduction in hospitalization.
Yeah, so I'd say a couple things on that front. We do actually do an annual donation of about 500 hours of therapy to select groups. This year we are targeting the young American population. Certainly there is so much trauma and anxiety there that we know that there will be terrific benefit from that. Specifically on the Medicaid side, we are actually starting to work with Medicaid through some of our insurance clients currently, but we're always open to discussions. We do honestly get a lot of inbound demand of our population would benefit tremendously, so we try to pick our spots, but we would be happy to talk further with you. Yes.
Sorry, as a physician, one of the big barriers, and I don't know if anybody's aware of the degree of physician suicide and how pervasive it is. One of the major barriers we have identified is actually in licensing and renewing your license and the questionnaires that you have to go through that ask if you've ever been seen for any psychological help in the past. And that is not just a stigma, it's a barrier because it becomes a flag. Has there been any efforts for lobbying state medical boards by organizations such as yours or others that are actually seeking to provide services to reduce those barriers or to change those types of questions, so it's not such an issue?
Probably a little bit less so on the question, but more so on providing the services for the population. So I can tell you we've talked to a number of medical schools who want to bring this to their physicians, and at the end of the day, unfortunately, it's like, oh, but we really can't afford it. It's kind of like the university discussion. They know they need this for their population, and they just kind of can't come up with the funds. This is off the topic of your question, but we've been more successful in working directly with fraternities and sororities, bringing this out to college-aged populations. But back to your question, we have tried working with different, even for the lawyers, the American Bar Association was very interested in bringing a solution like this out, and they still teeter with it, and a lot of times groups come back around maybe a year later and say, okay, now we're ready to pull the plug.
Maybe last question.
Do your consumers have access to their records, or do you keep like regular mental health medical records?
Sure. So it's a little bit of both, which is a great question. One of the real clear benefits is that the whole transcript between the patient and the therapist is there for them to see at any point in time. So if they want to go back and review what they discussed or messaged with their therapist from a month ago, it's all right there in their private, what we call room within the app, so they can see that whole history. Our therapists, of course, do keep clinical summary notes, which in different circumstances, if they were ever subpoenaed, that's what would show, not the whole transcript of what's gone on.
Thank you.
Sure.
Thank you so much, Lynn. That was great. Thank you.
It was a pleasure.